Alberta continues to see high case numbers in those under 18, so school age, with 3 more pediatric hospitalizations Wednesday. But Dr. Hinshaw stresses there's still no indication they are at a greater risk of severe outcomes.
Have more cases than even with the same percent of kids to have severe outcomes, we will see an increase in the number of kids who end up needing hospital care.
Parents and teachers seeing the rapid increase in cases, renewing calls for government contact tracing to come back to schools.
When I'm talking to my children, the emotional fallout is, we did everything we were supposed to do. We did everything the government said we were supposed to. Now we've got COVID.
Sherry says her daughter is one of 5 in her class to have tested positive. And even though Alberta Health Services takes note of which school a child goes to when they get tested, it's up to families to let teachers know of a positive case. The mother joining the opposition NDP to call for change.
The first question they used to ask when they'd pick up their child from school was, "What'd you learn today?" And now the first question they ask was, "Who is missing from your class today?"
Similar calls have come from the Alberta Teachers Association, Alberta Council of Schools, as well as the Edmonton Public School Board, who in a letter to the Education and Health Minister say they have taken on contact tracing themselves, but having to implement these measures at a local level with no backing from provincial government or health officials takes resources away from teaching and learning. The Education Minister's office saying in a statement, public health teams continue to work with school divisions like Edmonton Public to address any local issues, and additional measures such as localized rapid testing in schools may be considered should the need arise, saying they follow the advice of Dr. Hinshaw, directing us to her comments from last week.
And so last year, prior to having any kind of vaccine protection in the population, we had a very universal approach, and so we quarantined entire classrooms, which resulted in some schools having some classes off on 14-day quarantines several times over the period of several months. And that resulted not only in disruption of learning, but also mental health issues for the students.
Saying the best thing Albertans can do to protect our kids is follow health orders and bring cases down in the community. In Edmonton, Carly Robinson, City News.